Hey, we're going to be talking about how food handlers can contaminate food, personal hygiene, and glove use. Some situations that can lead to contaminating food is if that food handler already has a foodborne illness, has wounds or boils that contain a pathogen, sneezing or coughing on food, having contact with a person who's sick. So maybe if they're living with, let's say, their daughter who's sick, they could possibly be sick as well and contaminate the food. Using the restroom and not washing your hands, or having symptoms such as diarrhea, vomiting, or jaundice, which remember is the yellowing of the skin or the eyes. Actions that can contaminate food is maybe scratching your scalp, running your fingers through your hair, wiping or touching your nose, rubbing an ear, touching a pimple or infected wound or boil, wearing dirty uniforms, coughing or sneezing into your hand and not washing it, or spitting in the operation. Managers can focus on the following: creating a personal hygiene policy, okay, making sure all their employees follow it, training food handlers on personal hygiene policies and retraining them regularly to make sure that they are continuing this policy. Modeling correct behavior at all times. Managers are always looked at, okay? If you want your employees to follow you, you need to be on your best behavior in terms of food safety at all times. Supervising food service practices. A manager should always be on the floor watching their employees to make sure it's done correctly. And then revising personal hygiene policies when laws or science changes. Let's talk about hand washing. This one's huge. Where to wash your hands, okay? Wash hands in a sink designated for hand washing. You should never wash your hands in sinks designated for food prep or dishwashing, or sinks for discarding wastewater, such as like putting mop water into the sink. Okay, so only hand washing sink should be used for hand washing. Do not wash your hands in food prep sinks or dishwashing sinks. Steps for washing your hands. Okay, the whole process should take at least 20 seconds. Okay, first thing you're going to want to do: wet hands and arms. Okay, then you're going to want to apply soap, scrub hands and arms vigorously for 10 to 15 seconds. Then you're going to rinse your hands and arms thoroughly, and then dry your arms with a single-use paper towel. You do not want to use a cloth towel because that could harbor bacteria. Okay, so the whole process of hand washing should take at least 20 seconds. Avoid contaminating clean hands. Okay, if you're going to turn off the sink after you wash your hands, do it with a paper towel so you're not using your hands. Okay. If you're going to open the door after you wash your hands, do it with a paper towel. Okay, you don't want to contaminate your hands that you just cleaned. When to wash your hands. Okay, food handlers should wash their hands before preparing food, working with clean equipment or utensils, or putting on gloves. Every single time you put on a new pair of gloves, you must wash your hands. Food handlers must wash their hands after using the restroom, touching your body or clothing, sneezing, coughing, blowing your nose, or using a handkerchief or tissue, eating, drinking, smoking, chewing gum or tobacco, handling soiled items, handling raw meat, seafood or poultry, or taking out the garbage. Food handlers must wash their hands after handling service or aquatic animals, handling chemicals that might affect food safety, changing tasks, and before beginning a new task, leaving and returning to the kitchen or prep area, handling money, using electronic devices, or touching anything that may contaminate hands. If food handlers have touched food or food contact surfaces with unclean hands, corrective action procedures would be disposing the contaminated food, clean potentially contaminated equipment or utensils, and then retrain or coach that food handler that did the improper policies. Hand antiseptics are not to be used in place of hand washing, only after.